It's, I mean, you were described once, and I don't know the exact words, but something like care opinion is the single most important thing in the past 10 years that the Scottish Government has done for the public health system. Why would you say that? That's a big statement. Um, uh, yeah.
It's almost right, Michael. Why let the truth stand in the way of a good story? It's almost there. I did say something very similar. What I said was it's the most important thing we've ever done for person-centred care, and I think that's true. I genuinely think, and I would defend it today. We've done loads in this country, much of which is nothing to do with me or the government or anywhere else. So one of the things we've tried to do is tackle person-centred care from the very granular side of open visiting across all of our systems. So apart from this horrid pathogen we're dealing with, which has unfortunately had to roll back some of that. When we get back to the next normal, we'll have open visiting again. We've done that list that James just gave of having a compassionate complaint system. All of those, we got all that. But it still doesn't feel close to the user, does it? It still doesn't feel as though there's an actual way of linking staff, system, and patients and families. And that's what this has done. We did it. The thing about Scotland, and James will tell you this, is that any organisation that wants into Scotland finds it enormously frustrating to get in. But once you're in, you get the whole country. So we're very selective in who we choose. Yeah. We like to be sure that this is really going to help because we've got a very integrated health system with quite a lot of command and control. So if we say yes to something like care opinion, that's a big deal for us because that's going to go from Stornoway in the islands to Edinburgh. And that's what we did. So we ran some prototypes. We tried it in one of our health boards who got very enthusiastic for it. In fact, they put pictures on the back of buses. And they absolutely loved it. And I went to see it and got to know James, understood it. There was a Scottish version of the organisation. So Scottish leadership locally that was really important to us, people who could do the local training, who people could get to know, because just like care opinion itself, the organisation is relational. So we had to know people who we could speak to when it wasn't working, or we needed to train new groups of dentists or whatever we wanted to do. And then we went the whole country. I think at that point, it genuinely did become the most important thing we've done. It doesn't work in a week. James would make no claim that it works. It works immediately. It takes a while for people to understand they're not going to get in trouble. They're not going to break any rules if they answer Auntie Mary, who's written in about her COVID vaccine. They can just answer, and good things will happen. And I think that's been proven now.